Cardiac ablation uses heat or cold energy to create tiny scars in the heart to block irregular electrical signals and restore a typical heartbeat. The procedure is used to correct heart rhythm problems, arrhythmias. Cardiac ablation is most often done using thin, flexible tubes called catheters inserted through the veins or arteries. Less commonly, ablation is performed during cardiac surgery. Atrial flutter ablation, AV node ablation, pulmonary vein isolation, SVT ablation, ventricular tachycardia ablation. Cardiac ablation is a procedure that's used to correct heart rhythm problems. Any disruption in the signaling pathway can trigger an irregular heartbeat, arrhythmia. Depending on the type of heart rhythm problem, cardiac ablation may be one of the first treatments. Possible cardiac ablation risks include bleeding or infection at the site where the catheter was inserted, blood vessel damage, heart valve damage, new or worsening arrhythmia, slow heart rate that could require a pacemaker to correct, blood clots in the legs or lungs, venous thromboembolism, stroke or heart attack, narrowing of the veins that carry blood between the lungs and heart, pulmonary vein stenosis, damage to the kidneys from contrast used during the procedure, death in rare cases. Discuss the risks and benefits of cardiac ablation with your healthcare provider to understand if this procedure is right for you. Your healthcare provider may order several tests. To get more information about your heart condition before your cardiac ablation, you'll need to stop eating and drinking the night before your procedure. Your care provider will tell you how or if you should continue any medications before a cardiac ablation. Cardiac ablation is done in the hospital. A specialist will insert an 4 into your forearm or hand and give you a medication called a sedative to help you relax. The amount of sedation needed for the procedure depends on your specific arrhythmia and other health conditions. You may be being fully awake or lightly sedated, or you may be given general anesthesia, fully asleep. The healthcare provider inserts the catheter through a blood vessel into your heart. The catheters may be inserted through a blood vessel in your groin, most common, shoulder or neck, less common. Dye, contrast, may be injected through the catheter to help blood vessels show up more clearly on X-ray images. Cardiac ablation usually takes 3 to 6 hours to complete, but it can vary a lot based on the type of arrhythmia you have. Afterward, you'll be taken to a recovery area for a few hours where care providers will closely monitor you. Depending on your condition, you may go home the same day or spend the night in the hospital. Plan to have someone else drive you home after your procedure. Some people feel a little sore after the procedure. The soreness shouldn't last more than a week. Most people can return to their daily activities within a few days after having cardiac ablation. Avoid heavy lifting for about a week. Most people see improvements in their quality of life after cardiac ablation, but there's a chance that the irregular heartbeat may return. If this happens, the procedure may be repeated or you and your healthcare provider might consider other treatments. Depending on your type of arrhythmia, you may still need to take heart medication after a cardiac ablation. Thank you for watching this video. Hit the subscribe button so you can get new videos. You can read more about this on our website www.wellnessbuddy.com.